Teresa Freed with Johnson County Government. It's our goal to stop the spread of COVID-19 in our community. We also want to make sure you have the latest information on our efforts. For data on how COVID-19 is impacting the county, visit our dashboard on jocogov.org.
So if you've been told that you've been exposed or close contact to somebody with COVID-19, the first thing we're going to ask you to do is please go home. And the reason for this is even if you're feeling completely fine, you can still spread the disease up to 2 days before your symptoms actually begin. So even though you're feeling fine, you may be infectious or being able to spread COVID-19 to people around you. So when you get home, if you have the ability to sort of be away from your family members or your roommates or your household members, that's really the best plan to prevent them from also getting sick. If you have to be around them, we certainly recommend that you wear a mask at all times. Definitely don't share utensils. When we talk about COVID-19 spreading, what we're thinking about are those respiratory droplets. So sharing utensils or glasses are prime ways that this disease spreads. So really being extra careful around your household members, your family, to prevent spreading the disease. Now, we're going to recommend that you stay home for an entire 14 days because that is how long it can take COVID-19 to develop and to show symptoms. But we recognize that 14 days is a really hard time, a really long time for people to stay home. CDC has come out with ways for you to return early from quarantine, but still monitor your symptoms for that whole 14 days. So the way you can do this is you can quarantine or stay home for 10 days from that last time that you were exposed to an individual with COVID-19. And on day 11, then you can go back to your normal activities. Or if you want to get tested, you can go get tested with a PCR test. And so that's going to be something like the Johnson County Department of Health and Environment does, or you can go to gogettested.com/Kansas and find a location there. And what we're going to ask you to do is get tested on or after day 5 from your exposure. And your exposure is considered day 0. So when you test on day 5, you're going to have to wait until those results come back. If those tests are negative, then on day 8, you can actually go back and return to activities. However, I want to caution you that this does not mean that COVID cannot develop through that 14-day period. So you really want to make sure that you're monitoring your symptoms multiple times a day, checking your temperature, and just understanding that if you start feeling unwell, you really need to go home and consider getting another COVID-19 test. If you do one of these shortened quarantine periods, the really key part of this is that you don't have any symptoms. Again, our whole point with quarantining and asking you to stay home is to slow the spread through our community and protect our healthcare system. So monitor your symptoms. If you're feeling unwell, please stay home and take care of yourself as best as possible. So if your household member has been told that they are positive for COVID-19, that now means that you have been exposed. So this means that your quarantine time, so how long you need to stay home as a close contact, actually is going to be beyond when your household member is able to go back to their activities after having the disease. And this timeline sort of depends on how well the person who's positive is able to isolate away from the rest of the family. If they're able to be in a separate bedroom with a separate bathroom and really spend no time at all in those common spaces of the house, then you want to count your last day of exposure from the day they started isolating. So the day that they found out they were positive and sort of went into that other bedroom. And from that point, you're going to account for the 14 days or the 10 days for that shortened one, or if you're going to get tested, you're going to go 5 days and then go back to activities on day 8. Now, unfortunately, if that person is not able to isolate away and not able to go to that separate bedroom, and so you're continuing to be exposed during the entire time that they're infectious, so during their 10 days, then your last day of exposure is going to be the last day that they are considered in isolation or infectious. So you're going to go from that day 10 from their symptom onset, and that's when you're going to start counting for your quarantine period. So let's just say that my household member became sick on December 1st. That means that their isolation period would end on December 11th. And if they weren't able to isolate away, December 11th is when my quarantine period starts as a close contact. So that means that on December 11th, that's my day 0. And then I would be able to test on day 5 and potentially be back in activities by day 8. And if you're going to quarantine for the full 14 days, which is, again, what public health recommends, that's JCDHE, CDC, and Johnson County's recommendation, is that full 14 days, because it is the optimal way to prevent COVID-19 transmission in our community, then you would be in quarantine through December 25th and would be able to return to activities on the 26th. So if you choose not to get tested as a close contact, then you're going to want to quarantine for 10 days after that last exposure. In the example where somebody became symptomatic or began showing symptoms on December 1st, and was unable to isolate away, as a household member, my last day of exposure to that person would be December 11th, so 10 days after their symptom onset, and then I would quarantine for another 10 days, meaning that the last day of my quarantine period would be the 21st of December, and I could return to activities on the 22nd. In order to return to activities, though, you must remain without symptoms, and that's the really important part. And if you do have symptoms, we're going to recommend you go ahead and get tested, because the likelihood is that you have COVID-19.
For more information about COVID-19 in Johnson County, visit jocogov.org/coronavirus. You can also subscribe to a daily e-newsletter with the latest data and precautions being taken in the county and state.